Tena and Pharma laboratories tests
services, especially cutting abantu abamu x-rays abasawo bazeetaaga nnyo amagumba problems n'amagumba n'ebintu ebirala.
My name is Doreen Nasasira.
My name is Nasasira.
And I'm with my friend here.
Bina, baby.
Thank you for coming.
Oh, you are most welcome.
See you.
Good to see you.
Thank you.
Size of Balasa. This is Tena Pharma. We muze tubasanyukidde tukebera buli kintu kyonna nga bw'oyinza okulaba muno mu profile mulimu testimonies zaffe yeah.
There's something I've seen here about home care.
Yeah. Kati
you offer katisimitegeera nga muli mukola everything.
You know, medical eri broad.
Yes.
You know, kati tuyina ekyatuleetera okuteekawo home care services. Tuyina innovations ze twakola studies, twagenda mu Europe ne tubaako bintu bye tukolako research.
Yes.
Ne tupartneringa n'abantu abamu. Ne tufuna tiimu y'Abannayuganda abavubuka ba biomedical engineers.
Yes.
Ne tudesigninga system. System eyo gadget eyo bagiyita Vitotech. Eringa essaawa eno. Actually, any time it's going to be on market.
This one?
Yes, eyo Vitotech.
Vitotech.
Vitotech eyo ekwata all vitals. Olina pressure, olina ebirwadde ebyo balaba, blood sugar, temperature ziri high, biki tusobola okumonitoringa remotely. Oba oli Isingiro, oba oli ludda wakati ffe kye tukola eyo gadget yaffe bw'obeera ng'olina smartphone tuteekako application yaffe ne tukuwa eno n'ogisiba ku mukono. Bw'oba oli awo omanyi abantu bandi bafudde, oba oli minisita, oba oli mulimi, oba oli ani, pressure esobola okukuba naye ng'ate tekuba bukubi bwetyo eba erina gundi zezenge woninga ne gwe nga tosobola kiraba okitegeera, but for us tuba tusobola okulaba. Kati bw'oteekako essaawa eyo communicatinga ku app eno ffe tupikinga from app. Tuyinza okuba nga tugeze bw'oba oli Isingiro tulina eddwaliro lye tukolagana nalyo mu area tuliwa platform nga lyala nga balina computer kuliko ne ka alarm ako wabaawo gundi ezze yonna ng'ekarami nga kati bali ne bamanya nti omulwadde swan so katuwa ne gundi w'oli location nti ali danger ali here. Either bwe kiba wasi ambulance ng'ejja n'abadokita bagenda okuyamba kurescuinga oba nga kitandika ne bagamba waye okola ki taking eddagala lino kola kino okutegeera. So ekyo kiyambye nnyo era mu bazungu kyobula abazungu bawangaala because baba monitoringa nnyo. You don't need to have a doctor. Ate kino twakizudde nga kiyambako n'omuntu okuba nga akyalira nnyo badokita. Ogenda ng'ogenze kukebera pressure novaayo n'ekifuba novaayo n'obulwadde obulala you get. So ekyo kiyambako abantu naddala abakaddiya abatandise okukula. Yeah. So kati home service it's one of the part.
Yes.
Ekyo home care tulina bannansi bangi.
Yes.
Era twalina kaawe mabega program nga tufuna bannanses okuba nga tuba interviewinga turegistinga tulabe nti basobola okulabirira abantu bano. Nansi bano basobola okukolera ewaka era bajja waka home care kyobula home care services. Kati tumuleeta ne tumuteeka ewakaawo ne tumanya nti ono mulwadde bwati ne bwati ne tumanya nansi ajja kusobola okulabirira omuntu oyo amanyi nti alidde amize eddagala bulungi. Abamu baba tebasobola kweyamba amusobola omuyambako n'amulongoosa n'akola atya n'akola report ne bamuggyako samples. Kati tulina bagayi baffe bakuliya guys najja n'akimayo samples eyo ne zijja mu laabu zaffe ne tukola report nga tumaliriza ne tuweereza dokita. Abamu babako ne ba personal doctors tubaweereza reports nti okusinziira ku samples zetutekinze these are the results. Dokita n'amanya kye balina okukolera omulwadde oba n'agamba nansi oyo mukole bwatyo oba nja kujjayo nyongere omwekizamininga then tulabe kiki tuba tumukolera okusinziira ku condition.
Samples ezo zibeera contaminated.
No, we have professional people abakola ebintu ebyo era basoma ebya lab balina certificates zaabwe from Allied Health baba basobola okukola ekintu in a professional way. Even engeri gye transportingamu ebintu ebyo tulina cooler books zitambuza samples zijja ziri well protected okubanga zigetinga contaminated. However, contamination esobola okubaayo due to different things because wabawo ne human error zibeerawo ne but tugezaako kubanga ebintu ebyo tubyavoidinga because tugobera SOPs ezaki ezigoverning ebintu bino engeri kigye
So home care.
Yeah.
You focus on what? Or you get to bakulu boka. So
si bakulu boka. Tulinayo katika mbabulire ekintu ekirala. Tulina abantu abakulu abawo abakadde nga akaddiye. Tubawo n'abalina zi stroke nga oluusi sina mukadde. Ne tubawo abalina illnesses ez'enjawulo eziri chronic. So abantu abo oluusi nga gwe ng'omuntu weewaawo omwagala nnyo is your father, is your mother, is your aunt. Naye nga tolina busobozi busobola mulabirira. That is one. Two, abantu abamu bali busy nga bazadde baabwe babaagala naye nga beetaaga bano bannansi okubabeerako babayambeko balabe nga bamira eddaga ate nga abantu baabwe bakyabaagala babe nga balamu.
Gamba kyebagaana bwagazi n'okubeera nga bagenda mu malwaliro.
Yes. Actually, waliwo abakadde we twesanga ng'omukadde yeetaaga even special medical bed at home. We provide even ventilators yeetaaga okubaako oxygen for some time. We provide at home. Tujja ne tukola tumwexamininga ne tumanya this is what is needed. Ne tumanya tujja bisettingawo we agree ne tusigninga contract n'omuntu ali responsible finance. Ne tusigninga contract twagala kuleeta nansi waffe afuke house girl. Yeah, so tumanya nti ono ekimulese kino kyekino alina okumekinga sure sirenze omugamba yoza engoye zino simula ate wano ebintu tewabyozeza wali tewayoze lujja tuleeta bano abantu baba basoma abaana bangi basomye obusawo ne bayendinzaako nga bagenze mbwakadaama ekitali kibi but we need these people here. Yesterday nabadde ndaba ku TV nga ndaba PS wa health bali tulina concern yabo ba medical practitioners nga bafulumye eggwanga ekiteetaagisa n'abasomesa ne kati ku side yaffe kigetinga too much and we need to help these people babe nga bakola naffe.
Okay.
So
packages ziri zitya like mukola mwezi wiki naku
kisinzira tulina weekly tulina ez'omwezi normally neddaire ebeerako kati kisinzira kubaako packages ezikubaako daily fee ne kubaako weekly ne monthly then ne kati ezannansi ezo zibaako kubaako ebintu era ebibwajja zonna packages zibaako. Secondly ekisibadde sinabagamba kyekya tuli mu myaka egy'abavubuka abangi okitegeera abazeeyi batukendeddeko 52 around kati tutuuka okuzaala simanyi obanga Doreen osobola okulabirira omwana ng'omuzadde omanyi si byangwe edda walina nga senga wasobola okujja maama wo najja n'akuyambako ebintu ebyo si ebimu si byangu kati tebikyalinga yes kati omuntu asookana oyo ayinza okugenda ng'agenda kuzaala agenda kutandika okuzaala omusajja n'asawo n'agamba okusinziira condition ya mukyala wange gyalimu nze nja kuba ku mulimu biki yeetaaga nansi atandika okubeerawo let's say during that last month nga omwezi ogusembayo ne bw'aba amaze okuzaala asobola okumunyigako asobola okutereeza omwana ebyo ebintu bwe bityo so nabo tuba tubeetaaga okuba nga tukola ki nga tubalina tuyinza okuba nga ye service tusobola ogiwa ku muntu asobola
because mulimu abamu nga for them they're not allowed to move nga tebakkiriza kutambula ab'embuto nga their condition is sensitive so nga musawo alina kubeera nga ajjaka so you do also that nebayambako ne continental
yes definitely because ne wano tulina antenatal services kati
so you said it's a medical center
it's a medical center
equipment yes ndaba equipment the gadgets are very good naye ate kati mu ennaku zino bagamba nti amalwaliro agasinga si bizimbe naye ng'ate n'abasawo balina okubeera nga abasawo ki boolina
tulina abasawo tulina abadokita ab'enjawulo tulina abasurgeons however tulina theatres zetukolagana nazo because gundi zaffe twalabanga wano watono tetusobola kufuna tulina ekifo ekirala ekinene wetuli okumaliriza mugenda okubeera theatre zaffe ziri ez'amaanyi naye right now tulina abadoctors bonna tulina ba pp webali tulina bagayini nabo abaddala abali professional tulina orthopedics webali tulina different specialists
ekirala so oli waba ayagala kumanya Tena Pharma laboratories basangibwa oba medical center
tuli wano Koto opposite B+ furniture era kizimbe okiraba kya green n'ebipande byaffe bibaawo wekiri oba osobola okutulaba service ezo zonna we ziva nezisooka ate tutambula mu bantu nga bwe tugambye nti tuba ne even home care ekiryoka tutuuka mu maka g'abantu eyo tubayambirayo omulwadde abeerayo eyo nansi ng'amulina eddagala lisobola omutuukako because dokita bw'amala kutubuulira eddagala omulwadde lyeyeetaaga pharmacy weeri ate nga balivuga balikola ki balireeta mulwadde bwe yeetaaga okuba nti dokita agambye mumugyeko sample bweti nga bagireeta ng'erwaninga muki mu laabu yaffe nga tuweereza lipooti dokita because dokita waliwo abalwadde abamu nga badokita baabwe they have their personal doctors.
Yes, that's very true.
Waliwo n'ababa nga badokita baabwe bakutena kati abalina ba personal doctor baabwe tukola ki tubaweereza reports ne bamanya nti this katulabe kye tuba tukola oba tumukole sample n'oba kati yeetaaga treatment bwetyo okusinziira ku results ze tuba tukoje. Yes,
so are you going to take us around?
Kati bafunira omuntu aba taking around mulabe ekifo kino buli kimu mukirabe what we offer we have services buli kimu namwe bwe muba mwetaaga kubajanjabako nga tutandika omugongo
onondoza hips akalakoga.
Okay, now let me hand you over to Gloria. She's our lab manager. About taking it around, and you see the place. Then after,
Okay.
So this is our reception
at Tena.
Yes, at Tena Pharma, and what happens here is this is where the patient details are taken from. For example, we register from here, and then our system is integrated in that once you've been registered here, the doctor can access, the lab can access, so we can be able to see what's going on. Yes, and also what makes it unique is for those sensitive tests.
Yes.
For example, like the DNA, as we shall see, the patients, we take their details. For example, the fingerprints, so we can capture their details to know how sensitive these tests are.
Okay. So here, do I just smile? I can see a camera.
Yes,
here.
there is a camera. We can be able to capture your face on the report, and also your.
It's my first time to see that at a medical center, even in a hospital. Then here.
So for this part, this is our pharmacy, and we have all the medicines. We have antibiotics, we have medicine for children, we have antifungals, Like we have all the medication that.
So I can walk in here with a prescription from a doctor, and then get medicine, or it's from.
So it works two way. You can walk in with a prescription,
All right.
or you can walk in and see the doctor, and the doctor prescribes, and then we give the medicine.
Oh, nice. Then
So this side.
I'm saying no eating, no drinking, or applying cosmetics in the laboratory.
Yes, this is a medical place. We don't expect you to eat. You could easily get sick. So we
Okay.
don't expect you to eat.
All right.
Yes.
My name is Doreen, Nasasira.
I'm Bina, Babie.
Babie, nice to meet you. I'm Dr. Saddam.
Hey, Dr. Saddam.
Saddam.
Nice to meet you too. So, this is, you get to measure.
It's finger manometer. It's finger manometer, and this is a cystoscope to
Okay.
measure the blood pressure.
All right.
Yeah.
Oh.
Measuring pressure,
Blood pressure. Yeah.
blood pressure.
And this is for hearing like heart sounds.
The heart sound.
Yeah.
So when it's pumping,
That's pumping. Yeah. You put it in the chest, and you'll hear the heart sound, or even use it to hear like a chest sound.
can you try a bit?
When you're breathing,
Yeah.
Dodo wants to try.
when you're breathing, right?
So what happens? I sit here,
Yeah.
so you can tell if
It is
my
better.
heart.
It's better that to be on bed or on the couch.
Oh.
Okay, I understand. So what happens? This is my heart.
Yeah. This one.
Yeah, that's my heart.
And this one. And just below this side.
Even this side?
Yeah. And
Hey!
yeah, this for the chest.
Oh yeah, this is
Yeah.
for the chest.
Yeah. Okay.
Okay.
For the chest. But it is better
when you're lying down and okay. So you
heart
get
sound.
it.
There is 4 areas to hear.
Oh,
Like used to like you all use these 2 times. But
here and here.
yeah.
Oh, that's when you get to
The
tell
other
if
two
the
sides.
heart is in good
In
condition.
good condition, there is normal heart sound and there is a second heart sound.
Oh,
If there is other sounds, that will be abnormal sound.
okay.
And also use it for hit the abdomen, the stomach.
Here?
Yeah.
Oh! Where the belly
This
is?
side, below the umbilical.
Oh, here.
Yeah, that's that.
So now here, what happens? Like you,
Yeah, they be seeing like the
something moving in the
bowel
stomach.
sound. We hear it called bowel sound.
Oh, bowel sound.
Yeah.
Wow.
Yeah.
I didn't know. Interesting. Thank you, doctor.
Thank you, doctor.
You're welcome.
Alright. Still at Tena Pharma
So yeah,
laboratory.
So safety first. Depending on what the doctor has requested. So we have different correction tools and many more others.
All right.
So like we shall get to the lab and get to see.
Yeah.
This tube is used to collect samples
Okay.
that are for mainly chemistry, as we shall
Alright.
see the other side.
Yes.
And then this is where the hematology, whole blood samples are collected.
Okay.
Yes.
So why do you always tie us
So
things?
the reason as to why we tie,
Picture too. Okay. The reason as to why.
the reason as why we tie is we create pressure. When you tie, you tighten this, you create pressure, and then the vessels, the blood vessels, can be able to come on the surface of the skin, so that they are visible, they are palpable. You can touch and feel it.
So do I have one?
Absolutely. So you can see this dark one.
Yeah.
In fact, sometimes they don't come on the surface that you can see the blood in them,
yes.
but through touching like this, you can feel the palpitation. Yes.
Then
So
why do others pierce us and we feel pain and the other we don't?
I think that's the technique, basically. That's
Then
just
why
the
do you tell
technique.
us to fold press?
So when you make a
A
fist,
fist,
you
yes.
exert pressure on this, and then they come on the surface. And also making the fist, and now that you've tied here,
Yes.
our blood is drawn from the vein. So the vein takes blood back to the heart.
Yes.
When we tie, it means the blood which is supposed to go up is concentrated within this region, and so you can see we have.
Then
our
you
blood
tell us to do what? Not to open the fist.
Yes, you open the fist once we have collected the sample and we are getting out the needle from the vessel.
Access to the lab. It's very okay.
Erinnya lyange ekitibwa Kigundu Mike era nga ndi lab technologist from Tena Pharma laboratories. So sample etuzifuna nga zivudde eri etuzikuŋŋaanyiriza katuwejja tuzituukisa wali benki n'olemera wali naye wetumala okugifuna sample ejjirako request form. Request form ze zino zetussa wano. Buli sample gyetuleeta kale buli muntu gwe tujjako sample aba ne request form ye. So tusobola oba sample nga nyingi, mulimu omusaayi, musulo bwezitu. So naye buli muntu abaze aba ne request form omuntu. So wetumala okufuna sample nga tulikodinga wano.
Then no recording our. Okay.
So sample tuzisuukiza wano ati ez'omusaayi tuzisootinga ne tuzizza wali olengera awo weezisinga tuba tugenda zicentrifuginga
Emmoza lining wali mukali akantu akalinga crate.
yes ati ezeetakiso centrifuginga
Centrifuging byange. What is that?
A centrifuge, basically what it helps us to,
Yes.
we get a sample from the other side, it's still a whole sample. So there is why we need to get a liquid part out of the other solid part. So when we spin, the solid part goes down, and the liquid part comes up because we need the liquid part for further examination. Yeah, so that's the centrifuge, that's what it does.
Okay.
Yes.
so kati tulinawo mashini yaffe eno eyitibwa microscope sample zeetagisibwa okubeera nga tugitunulamu tulabe obuwuka ki obulimu tukikolera wano. So tukebererawo malaria, musulo urinalysis byonna tubikolera kweno. So
Are we
sample
allowed to check? Have to be
Nagalikiza.
Doreen.
Yes, you can, but that would need to have to put a slide. You can put a slide for it so that you can see. Yes.
naye kati awo osobola olaba just right.
A picture.
But me, I'm short. Hey, I've seen. But oh yeah. So no HIV bichi. Oh okay. But then
So
like that.
sample ejja nga yeetaaga kukola CBC machine gye tukozesa ku CBC.
You know CBC.
CBC machine.
CBC.
CBC tugikolera wano kweno machine.
Mukola batya?
Eraba engeri state omusaayi gwo guno general state y'omusaayi gwo white blood cells zirimeka, red blood cells ziri zitya, amazzi gali gatya mu musaayi, ebyo byonna machine yekebera.
Just to add on what he had said, so this machine specifically is a 5-part. So we have 3 parts and we have 5 parts. What makes it a 5 parts is when we are looking at white blood cells, we can be able to analyze each individual parameter under the white blood cell. Unlike other machines, which just look at white blood cell as a general thing. But here we can be able to look at the neutrophils, lymphocytes, monocytes, eosinophils, basophils. So those particular types of white blood cells, each comes out with a report. We can be able to look at it as an individual.
So this one is advanced.
So this is advanced.
Wow.
Thank you. This is more advanced than the 5 parts.
Wow.
I mean the
So,
3 parts.
Here I can also
Wow.
tell whether one has something to do with cancer of the blood. What is it called?
So now,
Leukemia. One or still, you can't.
This is
These
different.
are the awareness specific about
Couple.
cell.
Kati man ndine omuntu wange ne nga tugenda kwewasa nzija, I can come. Then you can tell whether
They are carriers.
they can okay.
Okay.
Can't take it. Chemistry analyzer. Bitegeeza ki?
Ndaba kale kubira chemistry w'omusaayi.
Chemistry w'omusaayi kale.
Okay, now how about this? It's a chemistry machine, and under chemistry we analyze body fluids. Body fluids like serum or blood. Serum is gotten from blood.
Yeah.
We can look at maybe urine, but when we are looking at those samples, we are looking at in case of disease. So the basic organs that we can diagnose or that can be used to look at this test, we have the lipid profile. So lipid profile, this test looks at the fatty content of your body. You've heard of people that develop atherosclerosis?
Yeah, I've heard of that. There are those who say they have fats in the
around the heart,
heart,
the blood
vessels. Oh, this is it.
So the lipid profile tests. Then we have the liver function tests.
Wow.
If you want to maybe know how your liver is doing, people who take alcohol.
There are those who have fatty liver as well.
So the people who take alcohol.
Yes, alcohol damages the liver. In
Yeah,
the long
true,
run.
true.
So they need to do those tests regularly because alcohol damages the liver, like you've seen.
Then those on medication.
Yes, even those on medication, as we shall see. But when we come to medication, for example, the drugs, we shall now look at this one. Yeah. But this one, kidney,
Liver.
the kidney, the liver,
All right.
the lipid
Fluids.
profile.
So why do you have to step up?
Now this bench is a bit high and the machine is also high. So for people who are short,
Like that.
Era bya short. Nange munsosola.
So what do you see?
Bana esigwa, please.
it's very hard.
Hey, this is the machine. Woo! Bina, you're missing. There are samples here. They put things here. I'm seeing numbers. 21, 20, 17, everything.
If we expose it, it's okay.
It's covered. Okay. Yeah.
Wow.
Wow. Oh, that's beautiful.
Fertility one. Obanina amajame kamunda.
N'amagi bagabala. But this is hormones facility. Wow, beautiful. So this big machine. Big machine.
Machine ekola
Eliza? Sirimanyi.
Abaganda tebakiyizayo kigambo. So basically tugikozesa kukebera infectious diseases omuli siriimu, kabokongo, olubuto kale netusobola tunaba okukeberako eno machine.
Nimutegera nti dde lubuto.
Tesi ze tukolerako eno machine ziba confirmatory tests.
Wow.
Evayo nga eri positive eba confirming and
Ngoba inakabotongo tera inakabotongo.
Ganja eri sina kabotongo.
niba esobola okukakasa oba ddala oyina oba toyina
Kati Bina bw'aba afunya
kitangaasa
Bina bw'afuna akawuka mu dakiika musaawe March musaba kitegeera
so okitegeera mu nnaku nga bbiri
emunaku nga bbiri okay.
So the other tests which are done by this machine, we have like the hormone tests, like I said, fertility hormones. Like abaina complications.
Mulubuto mukuzaala.
So this machine can be able to test those fertility hormones.
Wow.
Then also you've had conditions where someone tells you their body cells are fighting themselves. Have you heard of that condition?
It's where their blood groups there is where they told us that it's mania, Mbu, when the blood group is the same, over there are certain blood groups where they both work O, is it then after Tunamino, Nezirwana? So the body takes it out thinking that it's
a foreign substance.
It's a foreign substance. Am I correct? Then some people get miscarriages.
That's also another test under hematology. It's called the Queen's test. But for this machine, people develop those conditions, their body cells start fighting themselves. We call that condition autoimmunity.
Autoimmunity.
Your system is meant to protect you from any foreign substance. But now it starts recognizing that itself as a foreign substance, so it attacks itself. So this machine can be able to test those disease conditions. Allergy, we can also test for allergy, different allergens. So with just one sample of you can be able to.
So let me ask about the allergy. You can tell what exactly I'm allergic to, or you just tell me that you have an allergy?
Basically, we have what we call an immunoglobulin it's called IgE. So we have doctors who are specialists. So when a doctor requests and we do that test, the results, the specialist can be able to
tell you
what we proceed.
That's beautiful.
Yes, and maybe the other tests that we can do with this, cancer markers. Cancer, so breast cancer, liver cancer, stomach cancer. This machine, prostate cancer. This machine can be able to do cancer markers. It can be able to do cardiac heart markers. People who have issues with the heart. This machine can do that.
Wow.
There are very, very many tests. People have issues with. Can do a lot, and the beauty with it is we can load multiple samples. For example, I can put your sample, and then Doreen comes, and then I load the sample. Wow! Just because I've loaded the first sample does not stop me from loading another multiple samples.
How long does it take?
So turnaround time is 30 minutes. So within 30 minutes, you have your result ready.
Is it also confirmation, confirmatory? I had to talk about confirmatory.
Now, in medical tests, we have what we call confirmatory tests. We have preliminary tests. We have rapid tests. So this machine is like it's made in such a way. I'm going to use the medical terms here. So we have what we call specificity and sensitivity.
Okay.
So it is very, very, very specific. In that, if it has confirmed something, chances are that 99.9% you have
accurate. Wow.
So that's why we call the test under here confirmatory tests. Yeah, but for diseases like cancer and autoimmunity, we don't base on one test. So we have other ranges of tests that can be done to come up with a diagnosis.
Yes. That means they don't need to press my boob. I can come remove and then check for cancer. Cancer what?
Breast cancer.
Cancer something. Cancer
markers.
Cancer markers.
Like cancer identifiers. in a simple.
I thought she's supposed to put her big book there.
No, this is different.
This one we just need one sample, just a sample
Blood
of blood, and
sample.
you on the other side, and then on this side, the machine is
It's
doing
too
your work.
good. I'm worried it may cost me an arm and a leg.
No.
Okay.
Like I need to save for a whole year.
Our tests are quite affordable.
Oh, good.
Yes, and besides them being affordable, we offer packages. We have discounts. For example, if you're going to do like the fertility profile, and it's a couple of very many tests under that, you find we are going to give you maybe a certain discount.
Oh.
So our tests, our services are very affordable.
So our men don't want to do fertility tests. Can I bring him in here? Then in the process, I convince you to put also the test the other side.
If you come as a couple, we use like medical ethics. We don't do according to your wish, but we do according to the
And you're ethical,
couple's
woman,
wish.
that's
So
nice.
ethical.
This one
It's not nice.
wants to do things
It's
behind
not nice,
closed doors.
you know men
Thank
think
you for
first
being
one not
ethical.
fertile, but also they also have
We-
fertility issues.
We have
Hey,
counselors.
they do.
We have counselors. We can take you for counseling, and then you counsel. And then at the end of the day, you find your mommy has.
Guys, he's all in.
accepted.
Let me ask. Which machine does the DNA test?
That's why we are going next.
Okay.
Dodo.
Help stop the spread of COVID-19. Or in a COVID.
Simanyi. Pesa n'ogamba manipulating sample n'engamba esoboleko.
Okugitegeka okugitegera osobola gitwala direct soka gitegeka netuka mu bundi gyosobola ogitwala n'okisa mashini okusobola ogikola.
So wano osobola okufuna sample z'ekiko.
So oziteeka omu n'olyoka ogikolako enyuma n'olyoka ogitwala mashini gibaamu.
Okay.
Omugaso gw'eno mashini omukulu.
So kyentwalira ebbanga tono nnyo nga nategeezezza oba nina covid oba sirina. N'oli eyeekwese waliwo batugamba oli negative ogenda okukakananga ate bagamba
Test tuba tugenda okukola nga tugenda kukozesa eno mashini neweba akakovi kali kamu tuba tujja kala.
Okay.
Kali kamu tukasobola kutuyalirira sample mu centrifuge vortex mixture. So wano wonna tuba tuli ku extractinga yakawuka ke tuba twagala okukebera.
so that mufuna proper medication
Si medication, kale results.
results ennungi.
Prepare our sample from this side. We use that, like he said, for infectious, like a sample you can easily get a disease from there.
Okay.
Like you've heard of sputum, people who do TB. We
Yes.
also process our samples from here for TB. And then also for COVID. So once we come this side, now this side is we are going to run our sample. So when we are going to run our sample, we have a machine here. It's called Ethlan 96. Yeah, and we have a system. We have a system.
No TB especially. Nibagamba TB amanyi okwekweka. Ne mumukebera wamba amadde ku antibiotics kibeera kizibu. Is that true? Oba wano neera mu mashini zammwe kisoboka okumusobola omudetecting.
But we have a system.
Omuyina ne tukolako PCR test ya TB.
Yes.
Tubasobola omudetect.
Ne bwe nva mbadde mmira antibiotics. Okay, good.
That involves analysis of the DNA, RNA. This is why we do it from paternity tests, for disease diagnostic purposes, viral load, hepatitis B and C viral load, cervical cancer, PCR. We can do it from here.
Cervical
This
cancer,
machine
I
can
can
go
come.
around. Yes.
So I can come and use my blood to know whether I have cervical cancer or not.
Now that also we can either use the sample, we can get we can take a pap smear. Yeah, we can take a sample from the female reproductive, the cervix, and then we extract or we prepare it to get out the DNA from there.
Oh, I thought I would skip the painful part.
It is still the other one.
Okay.
Unless if it has gone, if you've already developed the cancer and it's in maybe in the advanced stages, there we can use a sample of blood to do that. But initial screening, the best sample is the scraping from the cervix. Then you extract DNA. Yes. So when it comes to also paternity testings, we prefer blood. Someone might ask, "Can I bring someone's hair?" Because you don't want the other person to see you.
Yes.
Especially like you want to get a kid from the mom, and then someone, can we use hair? Can we use toothbrushes?
Yes, that's right.
Or if someone has died and you exhume the body, and mostly we use the femur bone, the thigh bone, in case someone has died. Yeah, but now those samples, they require extra attention, so we charge them a little bit higher compared to when you give us a sample of blood.
Okay. So if I come with hair, then you charge me way a lot of money.
A little bit higher, because the extraction or getting the DNA from that sample costs us a little bit high compared to when we have the blood sample. No, but everyone is welcome. Our prices are very affordable. It's all about coming, and then we work together.
You open from which day?
We open from Monday to Sunday.
Sunday.
Yes, 8 a.m. to 10 p.m. But we are looking at making it
midnight.
No,
24
like
hours.
24 hours.
Right.
So as we are expanding, Doreen, I think, and Babie, you've seen we are expanding. We want to be able to provide all the tests and examinations 24/7.
Okay, so let's move down. I've seen beds. I've also seen, I think you also have an eye area.
So going down, as we are expanding our facility, we have provided like a short admission for OPD. You come, you're not feeling well, and then you may be given treatment, and you need to relax a little bit, like an hour. So we have that accommodation down. So we shall look at it as we get there.
Ni sample tukolera wano kabatula badokta. Tebalina fuluma mu kubanga.
Anyway, you're welcome to Tena Pharma, Laboratories and Medical Center.
Yeah.
This is the radiology unit. Radiology, it is basically a branch of science that deals with medical imaging. So radiology is divided in two different parts. There's ultrasound scan, that's why you're seated. Then there's X-ray, which I'm going to show you later. There's also CT scan, which we don't have for now, but we shall soon get. There's MRI, radiology as well. And we also have special procedures like HSG, Marachala magnetism. But the pain is there.
Bina get them.
So the computer HSG is called hysterosalpingography. That is scientific.
Yeah.
So, but for now, we first talk about ultrasound. 80% of people know ultrasound. But now look at this. This is a quality machine. It is a Landwin E20X20. It has 3 probes. That is the transvaginal probe. But this is a transvaginal probe for transvaginal scans. When do we do this? This is normally done for early pregnancies, first trimester, at least between 5 to 10 weeks. It is very, very important. Naye in Uganda, very often atya because it is very sensitive. They relate together, HSG, but it's not similar. When you do it, it's a little discomforting, but it is not. So can tukebera embuto early pregnancy. Number 2, tukebera energy using this. Wow. What you do follicular tracking, like we can, those people with fertility issues, we can inject you with different medication and monitor the growth of the eggs. It's typical cycle. Then also, atwagakebera fibroids. This is also a better one. Can pick very, very small fibroids. This one can be very small fibroids. Wow. Yes. Then also, it's also very good for checking the uterus and other organs. Because why? One to get that direct through your vagina and it is direct access. As opposed, now this
And
is
I also
one
check
of-
cervical.
Yes, exactly. Because the uterus is, the cervix is part of the uterus. So we check it as well. So this is the transvaginal probe. Transvaginal endovaginal probe. So now this is one of the
Nsobola okukebera ku endometriosis.
endometriosis.
Bagamba mu wano mu Uganda tulina machine zikebera endometriosis. Weziri munenga bakaaba kubanga balitegeera leeti baba basawo.
No, why and of late why we now see it more because of better diagnostic methods, like better ways of identifying. Actually, I sort of call out to look out endometriosis, that is laparoscopy, which is part of the So now the next machine, this one is called the curvilinear probe. Okay, curvilinear probe. Katirino, Jimani, Kira.
You are taking a photo.
Era bwe diet is
So, bwoteka no obola we wano okungulu bali kweyambula.
ku lugoye abadala
Bali mwenye ku lugoye.
Before we do the scan, so can write a gear. This is the ultrasound transmission gear. The ultrasound is ultra means fast, very fast. Sound, very fast sound at a very high frequency. So this is sound that is very safe, very safe. It's not radiation.
Okay.
This is ultrasound, it's not radiation.
Okay.
So take out kind of a gear, then take out movie, give you say, curvilinear probe. We use scan top of the abdomen. So still this can help you one to have a uterus, to have ovaries, to have babies. Okay, because most of them use this. Okay, also able to scan men. Nasasira, prostate, so called second. Wow. The prostate. So we can also examine the liver, the spleen, the kidneys using this.
Oh, okay.
So we use this to examine
Liver,
the
kidney.
uterus first, or by the womb. Then anyway, so the other one is much more sensitive and better.
The other one is better.
This one is better.
But it has no
Sensitivity, no sensitivity. Yeah, it has a lot of bigger implications. Now, this can also be used to look at the liver, the prostate for men, the kidneys, organs kali. Maybe. So, kati kano. Kano. So this one is called a linear probe. Linear, this is line. But I can cut it straight. We call it linear. Kind of curve. It's called a curve. Curve. Curve linear because of the curve named linear. So, I want to demonstrate this one. Now this one is a linear probe. What is it used for? Tulabanga, let me say, we're in a swelling here. You can use this. If you have any clot, you can use this. A berry. So, but then we demonstrate whatever we found. So this is the girl. So tugenda kukyusamu So I'm just going to demonstrate. So I'm just going to look at your vessel that transmit blood, right?
Yeah.
I'm very sure you can always touch here and you feel something. So I'm going to demonstrate now. So this is a linear probe. Atya, I'm able to look at your muscles. Okay, now these are your muscles. This is bone. Okay, no, so that's how it appears. At science, that is your bone. So I want to demonstrate an area where we're going to cover your blood vessels. Okay? Blood vessels. Yes. So now, the girl has transmitted the sound, we're able to see. That is the feedback we're able to get. Okay? Yes. So, better begin to do whatever because this Bina. Okay. So now, I see what is red there. I see something red.
Is there something red?
Something red.
Yes.
So that is an artery. That is artery that is beating. That is taking blood. That is her blood vessel. Okay? So you can always demonstrate and see. Okay. So with this type of probe, we're able to examine the vessels, if there are any diseases, if there are any clots, that we use this as part of.
Alright. So is there a clot there?
There's no.
So this is an ECG, electrocardiogram. ECG. Okay? So electrocardiogram checks the heart. Okay? There are two ways of checking the heart. So what is saying electrical. What does it? It means that together with some cells in the heart, we try to see if, because the heart is designed in such a way that it is an electrical program. For that pumping right now, it is sending signals. So for us, we use this to read those signals and see if it is sending the right amount of electricity, energy to. Now, these are like native connect knobs. Okay, so I'm not going to connect on that because there are particular parts where we connect and these yeah, on your chest because we estimate where your heart is. Then these are able to pick. These are able to pick Okay, let me try to put. So if we put, let's say, I'm going to put on her chest. Okay, let's demonstrate.
So fine.
So I'm going to put on her chest. Let's say here. I'm going to put here because now these ones when you put them on, they hold.
Oh, they hold.
So let's say I'm going to put. You cannot hold it because of the pressure, but you put them here on the chest.
Fine.
Wow,
it's a bit cleavage.
So,
hey, Mama Nyabo, super guru. Magnets, Bina.
yes, Auntie. I'm trying to
Bina, they are pulling my heart.
Hey, you're just trying to demonstrate.
I'm just
demonstrating.
demonstrating.
Hey, whatever, Auntie. Let's put anti-cleavage. So these are just then you connect. I'm gonna shout that one. Oh, so but no, you're not going to.
That don't, please.
So I'm just explaining. So this is electrical.
Okay.
So it's ECG. So when it picks up those signals, it will send through this, and it picks up, and then we're able to read. If it's not reading, come here and check. No, so see what's happening. So you are not connecting well, but it has to read. When you connect well, it will start reading. Okay, and producing those signals. Okay, just brief.
Yes, again, Daddy.
Actually, I'll place some of the leads. These are leads. That's why it's reading a little bit.
Whatever is reading that
X-ray is now it's not X-ray is now what is radiation, what you normally fear. This is not safe. But we are always trying to make sure you give safe. So Chogola, there are notices that if there's even a pregnant person here, notified.
Dodo.
So notes, that was a caution, X-ray radiation, authorized personnel, Uganda. All this is to warn people that this is radiation here. Okay. Number two, your Mulati, Talina choice. Why? Normally, before we do X-rays or CT scans, which is radiation, we are normally aware the benefits and the risks.
Yes.
So when we look at the effects of radiation on the patient and the benefits, all about the benefits. What? Yeah, she has no choice. Number two, this place is always kept closed. Because it's letter complete, that doesn't allow any leakage of X-ray.
Okay.
So it's a lead door, doesn't allow. Yes, so this is also lead glass. You can look through, but
yes,
X-ray can't go through.
Hey.
Wow. No, this I'll explain that that's a control panel. The X-ray machine. This one. It's now on. That's the control panel. So now we are going. It's not on. X-rays. They are not on.
Okay.
Now these lights.
Yes, the light.
These lights. This is red. This is green.
Yes.
Red shows that when you are working, put on red.
All right.
There's danger. Don't come close. X-rays are now on.
Yeah.
Light is off. Green. It's okay. You can now do whatever you want to do because X-rays are not on.
Yeah.
Yeah. So now this is a fixed X-ray. Not moving. Now I think there are two machines here.
Yes.
So these are two different types. This is one which is movable, so which it tambuza. So in our room to what date? So atambula.
Oh. Yes.
So I'm going to switch on the X-ray, but I'm not going to put on the radiation.
Please don't.
Okay? Yeah. So now the X-ray is on. So the X-ray, that's an X-ray. So this is just a tube. These are lights. Now this X-ray is able to do different examinations.
Okay.
The first which you know, the chest, the common
Chest where we put here, they get it for COVID. They want to take out the
to call it.
Oh, love it.
Oh yeah, but them.
Nedda baba kano gasitowa nnyo okusingaako oyo. Kyemmanyi nateeka kuno bwe nti naye nga ne bagamba mbu nno lina simanyi okukola atya. Kyategeeza.
Now a demonstration, but that's a chest X-ray.
Yes.
Can also do an X-ray of the skull. Okay. Our sinuses.
Our sinuses.
Yes, you can also do X-ray of the spine.
Bongo.
Right from the neck. Baka
Wano se baka wano.
Okay. You can also do X-ray of the abdomen. You can also do to be called one.
Wano ku Tena Pharma Medical Center.
Tusobola n'okukola X-rays of those people with accidents, the legs, the hands, exactly, the feet and everything. The X-ray bikola.
Wow.
This is one of the state-of-the-art X-rays actually.
I know, right?
Now, X-ray what will we do? This is my demonstration. Demonstration.
Okay.
Atya.
Nga yeyogeza uno atandise okukankana foto sina simu erwa Babie, n'ekitanda kirimu formula. Badde simanyize nenya bulinyi.
Ntilako. Position sijagala. Kabini anti mune ebyo yandize lwagala.
Twale lisigalawo.
In a position so okweramu X-ray y'omugongo, the spine. X-rays can penetrate through.
Oh, this is an advanced machine.
They penetrate through. Sigenda kukuba tofa.
Manya nti nina akabina. Kati akabina ko.
So machine tete kutukawo.
I'm just
demonstrating.
So, X-ray. So, watching number X-ray is radiation.
Okay.
The more you're exposed to radiation, the more it gets harmful. It depends on the dose.
Okay.
Now, I'm saying, lunch. So I have to protect myself.
Okay.
Understand? So that's why I'm putting on like this.
Okay.
Now, these are called lead shields. Okay? So, X-ray is computer. Why am I protecting these parts? This part has the heart. It has the liver, it has the kidneys. Then I'm able to protect even as a man.
Your manhood.
Yeah.
Your family.
Areas of national importance.
Yeah.
So, now for her, we can protect here.
Okay.
Okay, we can protect.
You protect where? Let's see what you do.
Your mama wali cookie. Can you meet the one? Can you meet the one of Bina?
So, make sure.
So I is okay now.
So, and then we do our X-ray. This is positioning, then the control panel. Yes, kati osigala.
Yes. Ekibateekamu kabbulu.
Ate ebyuma bibino bigenda kukola.
Kebera. Kebera.
Bana. Nasiddayo.
Tugenda kukoza nti omuntu yakoze demonstration.
Aseka. Sigenda bigenda mwanga bibiruma.
Naye babikolera. Afaso bagododa akabira kotikalina akange ndi mu bbanga. So mbulira pain.
So
Ndi mu bbanga.
So now
Okay.
because HSG y'omukyala
n'akabina. Akabina
So HSG is a procedure, a special procedure that is done to look at the tubes. In the womb, when I was number Caesar, I've taken number not conceiving, master problem. Married couple, I've stayed for like 3, 4, 5 years that they don't conceive.
Conceiving.
So we do an HSG.
Okay.
HSG is a typical sterile procedure. Everything has it's not non-contaminated. Because we're entering into your vagina and looking through your. So it's basically sterile, non-contaminated. So these are the instruments for the HSG. This is called kidney dish. Different size. Even this one. Okay. With the contrast. So, can I count?
Tubayigizayo mu ndeyo. Akamani kaluma
ate kabera kanyogoka.
Kakwateko.
Never should go there when that was
So normally this is what we insert into the vagina. Then we're able to expose the cervix. Remember the cervix is inside. Okay?
Yeah.
So we insert and we're able to expose the cervix. So cervix is what we shall use to access the womb or the uterus.
The uterus, okay.
So if you take while we're going to create up, so these are machines. This is called Kantukaita uterine sound. Kankagezako to which type of uterus you have.
Hey, there are different types.
Wow. Yes. And how long it is. Always is it the killer one? Yes. The what?
Okay.
Okay. So we also use this to estimate the size. Now, these are cannulas. Zinozoita cannulas. Just take it. Zinozoita kulisamu eddagala ebintu eddagala.
Oh. Tubayigiza mu cannula. Okay.
Eddagala tulisamu. Then we tumala okulisaamu ne tukuba X-ray. Different points. Kati naye this procedure is done by 2 people. Omwe ayimirira eri nze nenyamba kale kuba ensindika eddagala. So we use these syringes, we mix this medicine, this name, yes. But we make through this canal. This just help us to hold the cervix in position. The cervix is something that is very loose. You have to hold it in position. Firm to give us a better.
That's why it pains.
Exactly. It is very sensitive.
Yeah. Wow.
That's why we didn't know. He's immediately after to come back to general part.
Sometimes you can bleed. You bleed actually. It's very sensitive.
Wow.
Sensitive.
So kids that in Nigeria.
So when
katukole hiyo
nedasirero nja kujja netegesa olulala bulungi ojja kwewuunya
ate nekira ekyo procedure tusobola gikola nga oli mu periods nejja. Number 2, tukikola on the 10th day of your cycle. Why? Because you don't want to do it when you're ovulating, because it's radiation. Please don't touch it. Hey!
Mama Checho!
day of your cycle.
The minute was about to the
Number 3, tukikola nga infections. That's to carry. Carry on, so no color infections. So to get your infection, Number 4 is about before prior to the examination.
But it was smooth.
So that means 3 days prior. So tumaze okufuna ebifaananyi oli mu x-ray tujja ne tubiprocessingira wano ebifaananyi tubiteeka kuno tubiprocessingira wano nebivayo weebiti. This is called the processing room.
Okay.
So the processing room tujja, it's like editing. Then from here we're able to interpret it. So this is basically the processing room for reports.
Okay. Then no local calling, right?
Nah, it call out interpreting it.
Switch.
The Tena Pharma.
Okay.
We tried to, but it's okay. It's okay.
So this is our outpatient. Short admission. Someone wants to relax. This is where they put their things.
Drip. Ako nange wakiri nkamanyi.
Nice.
So patients can be able to
Relax.
And then I can see we
monitored.
the beds, you see?
The beds are very comfortable.
Yeah.
They are medical diagnostic beds. Specifically. Yes.
And they are orthopedic.
Yes. Orthopedic beds. Orthopedic mattresses.
Okay.
Then
They spend the night.
Yes, they can spend a night with the supervision of a nurse and a doctor.
Okay.
Yes, so we have these 2 rooms. So here someone can be temporarily have a headache or drip, but this side in case someone wants to have a night.
spend a night, yes? These are the
In
rooms.
these rooms, yes.
Okay. So here when you're going to go that very day, basically.
Yes.
Okay.
If they put medication on you.
So this side is can be an admission, like an overnight admission, but it's temporary.
Okay.
Can be of a day, night,
Close monitoring.
for close monitoring.
Maybe
Like
as you get
doctors.
an ambulance to rush you to a bigger hospital.
Yes, and also we in collaboration with our neighbors here and other facilities, so we can be able to arrange for a special transit or referral to another hospital.
Okay.
Oh.
Beautiful. It's even self-contained.
Yes.
The bathroom.
Yes. So you don't have to move your patient out.
I
So we
know,
need to go
right?
through here.
Just after this, enjoy that smokable. Oh, so the bathroom can be shared.
The bathroom and toilet.
Alright.
Okay. Then this one is the outside door. And exit. So if I don't pay, I can exit from that side.
It's closed.
All right, thank
And
you.
then there is